To Halifax, Tim Houston, the Premier of Nova Scotia, is giving a COVID update. Let's listen in.
And since we can do that, we should do that, and we will do that. So with this 1 week, while online learning is happening, we will work to address 4 themes of concerns that we've heard. The first is around ventilation. There are 71 schools across the province that can do with increased improvements to the ventilation systems. This issue has been sitting on desks for years. We're going to pick it up and we're going to deal with it right now. Yesterday, we authorized the purchase of ventilation units for classrooms in those 71 schools. We've been told that many, if not all, of these systems can be in place late next week. The second issue is around masks. It's my hope that when children show up for in-person learning, there are 3-ply masks available to every one of them, and possibly even sitting on their desks waiting for them. So we use this time to try to get that done. The third theme of concerns is around testing and test kits. Tests are in high demand nationally. They're hard to come by, but we're working on it. It's my hope that a new shipment of tests that was ordered quite some time ago, that it arrives and is distributed to schools and available and waiting for each and every student when they arrive at school. So that's a work in progress. Hopefully a week from now we'll have more clarity on that. And the fourth theme of concern that we heard is just around the communication procedures. So we'll use this additional week to firm up and properly communicate procedures for things like who to notify when there's an illness. There will be COVID in schools. Everyone should take precautions knowing that there's lots of COVID around the province. But so these steps that the government will take will make the a safe school system even safer. So teachers and staff, you will be safe at work. Parents, your children will be safe at school. And students, you will be returning to a wonderful in-person learning environment surrounded by people that have your best interests at heart. Those are all true. The best place for our children is in school, and government will do its work on these 4 items, and our schools will be open. And I ask that we work together to remove any remaining question marks that still exist. Because the brutal reality in this province is that for some kids, school is the place where they are safest. They're safest at school. It's sad, but it's true. And the reality for many children in this province is particularly as we move into the depths of winter, is that school is the place where they are most warm. Again, that's sad and it's hard to imagine for many of us, but it's true. And the reality for many children is that school is where they get food. It's heartbreaking and it's a terrible reflection on our society, but we can't ignore it. Not to mention the socialization that takes place in school. All of these things weigh heavily on me as we push the start of the school year, of the return to school back by 1 week. It's a tough decision knowing all these factors, so I apologize. I also know that every time we change the school calendar, we traumatize those families who don't have the means to access childcare. So we must also remember that schools are as safe as their communities. Any steps that can be taken to protect communities, protect our schools. When those who can work from home or can slow down do, they're doing their part to slow the spread. And slowing the spread helps keep communities safe. And keeping communities safer allows kids to return to school. All of us have to be proactive in how we prevent ourselves from getting sick, but also how we prevent transmission to others. So people working from home or other community restrictions that are in place, they're not inconsistent with schools being open. In fact, they're very consistent. The more we do to keep communities safe, the more we are doing to give our children the opportunity to be in school, where they want to be and where they should be. I'm very passionate about schools. But next, let's talk about boosters. As of today, over 42% of the public that's eligible at 30 years old and eligible for a booster has either already received their booster or has their appointment booked. So that's not an insignificant number. But it's not 100% either. I realize that. Yesterday, 12,600 boosters went into arms. This is a new record since July. There's work to be done for sure in getting the boosters out there, but it is being done. If you didn't get an appointment or didn't get an appointment as early as you would like, keep checking back. We're opening more appointments daily, and there is enough vaccine for every Nova Scotian who wants one, and we're working hard to get that to you. We have large clinics now at the Halifax Forum, and we're opening a clinic in Wolfville next week. On January 17th, we will open large clinics in Truro and Dartmouth. Starting on the 10th, some COVID testing centers will offer vaccines by appointment. And I talked about this last week in kind of the split shifts. So those, we're hoping to have those in Truro, New Glasgow, Cumberland, Antigonish, Sydney, Berwick, Yarmouth. And the testing site in Digby will come on board in a couple weeks. So there's a lot of work being done on the boosters, so please be patient. I do want to speak directly to Cape Bretoners. I know there is a lot of anxiety in Cape Breton over testing. We hear you. There is an incredible amount of work being done to meet the need. Capacity has been added in Sydney, along with more rapid testing kits. We had a testing center open in New Waterford today. One will open in Glace Bay tomorrow. Sydney Mines, member 2, plus mobile units be on the ground hopefully by Friday. So again, there's a lot of work that's being done there. So thank you to the incredible work of the Cape Breton Family Resource Center. Joanna, I know you and your team have been wonderful partners working tirelessly to get these kits out, and I thank you for that. Before I turn it over to Dr. Strang, let me just say to Nova Scotians, I share your frustration, but I do want to say this. Seeing the professionalism and the dedication of the people working so tirelessly to keep us all safe, I have incredible confidence in the plans we're putting forward. I trust public health. The plans that we share with you are developed by high quality people that are using the best information available. Where things need to be updated and changed, we will adapt. You've seen that. But I have every confidence in saying that the plans that we are following, the plans we are sharing with you, are the best possible plans. Nova Scotians have been incredible throughout this pandemic. You've set an example for the rest of the country. Let's keep doing it. Dr. Strang, I'll turn it over to you.
Thanks very much, Premier. Good afternoon, everyone. The Omicron variant continues to create challenges here in Nova Scotia, across the country, and in many other parts of the world. There's no doubt we are right in the thick of the Omicron wave at this time. We've said all along that we have two main goals, especially with this wave. First and foremost, it's to protect the most vulnerable people from severe disease and hospitalization. And so far, that seems to be what we're seeing. And the second is to protect the healthcare system and ensure it can continue to operate effectively. And that is where we're seeing some real challenges now. Omicron is having a significant impact on our healthcare workforce, healthcare facilities, long-term care, home care, emergency services, and as a result, access to the care and delivery of many services. Our hospitals are over capacity. For Nova Scotians, that means waiting too long for care or having long-awaited tests or procedures canceled. I'm not saying this to scare anyone, but if you are experiencing an emergency, you will get care. But if your health concern is not urgent, please at this time do not go to an emergency department. Visit your family doctor or walk-in clinic or use the 811 telehealth line to help get direction. The reality is there's very little flex in our healthcare system right now when we're asking everyone to help support the teams who are doing everything they can do to ensure people get the care that they need. So extending restrictions that are currently in place to January 31st is a necessary and important step to continue to slow down virus transmission. It also gives a couple of weeks after children are back in school to monitor how that's going, along with the spread in communities, to determine what our next steps might need to be. But please remember that the restrictions only take us so far and only work if everyone follows them. It's also critical that we each do our part, closely follow personal protection measures to slow the spread of this variant, and that includes getting vaccinated. Many people are questioning the vaccine, but I need to be clear. The protection we have from our very high level of vaccine coverage is what is keeping us as safe as possible, as safe as we are right now. I don't even want to think about what Omicron would look like if we didn't have vaccination. So like the virus is evolving and changing, so too must our response to the pandemic. We need to look at some clear and honest facts. We've been at this for almost 2 years, and there is a lot of COVID fatigue and frustration. But we've also learned a lot about COVID-19. We know much more about how to prevent it and also how to live with it. We know that restrictions help to prevent spread, and we also know that they have unintended consequences like placing stress on our individual and collective mental health and our economy. We know that personal protective measures also work to keep us safe. And these are things that are within each of our control and relatively easy to do. We know that we have high vaccination rates, as I've talked about, and we're starting to get booster doses into arms with a plan to give one to every Nova Scotian who wants one at an appointment in January or February. And at the same time, we're continuing to offer first and second doses to adults and first and starting to be soon second doses for children 5 to 11. So when we look at all these facts, it's clear to me, and hopefully clear to many others, that our response to the Omicron variant can't be the same response that we had in wave 1, 2, or 3. We are in a different place. And we're asking people to do things and accept approaches that may feel uncomfortable because they are different from what we've done in the past 2 years.